Hello, everyone. Thank you for joining us. I'm Jessie Lane. I'm the Communications Manager here at the CHAMPS Program Office. We are so glad that you are joining us from wherever you are for an introduction to using CHAMPS data, starring our very own Dr. Dianna Blau, who is Senior Director of Science here at the CHAMPS Program Office. A few housekeeping items. Please note that at the bottom, the Q&A is available, and we encourage you to use that to submit any questions you have for Dr. Blau today. I'll be directing those questions to her throughout the presentation, and we will also have time at the end of the presentation for more questions and answers then. With that, I think I'm going to let Di take it away. Di, go ahead.
Thanks, Jessie, and welcome everyone. Good morning, good afternoon, good evening for all of those, and we're very glad to have you. What we're going to try to do in this first of a series of webinars is to give you a brief high-level overview of the CHAMPS program with special emphasis on the data, because ultimately what the goal of these webinars are to encourage everyone that's listening and anyone that you then reach out to use CHAMPS data, to look at it on a regular basis and always come back to it. So as Jessie said, please feel free at any time to put questions in the chat, especially if they come up and you want something more clarified as we're going through, or a question. We can take questions during the presentation. I will stop the video right now because, again, the emphasis is going to be on the data, but we'll come back up after questions. So to start off with, we want to just give a high-level overview of the CHAMPS objectives. And so CHAMPS has three major objectives. The first one being to better characterize the main causes of under 5 mortalities in areas where it is highest. And CHAMPS achieves this by having a more comprehensive approach to mortality surveillance. And this includes more complete data collection and diagnostics. And the minimally invasive tissue sampling, or MITS, is just an example of this. And I will go into and describe the MITS procedure a little bit in a few minutes. The second objective is that this quality cause of death data coming from the CHAMPS network is available in real time. And so that there is no lag into translating this data, this cause of death data, into action, with the ultimate goal to help reduce the morbidity and mortality in children under 5 at all levels, at the local, the national, and subnational levels. For example, within one of the CHAMPS specific surveillance sites, the team could be seeing numerous deaths that are attributed to insufficient clinical diagnosis or management, and they immediately can take action by retraining the appropriate clinical teams for management for certain conditions. And then finally, CHAMPS aims to serve as a platform for sites to leverage the CHAMPS investment in a more large-scale effort. For example, looking at vaccine effectiveness, especially those that might have been prioritized by organizations or pharmaceutical companies based on CHAMPS data. And say Klebsiella vaccine to prevent neonatal sepsis could be an example of this. So we hope that all of you on the call today or listening in the future will be excited to look at and use CHAMPS data to further take action to reduce under 5 mortality in your area or other areas of interest. With this first presentation in the webinar series, we aim to provide, as I said earlier, an overview of CHAMPS with the focus on where, what, and how the data is collected. And then we'll start on an initial deep dive on how one can access and analyze the data from several levels. So to start, we currently are collecting this quality cause of death data in 7 main surveillance sites, with an 8th one launching soon. And these sites are found within 6 of them are in sub-Saharan South Africa, 2 in West Africa, 2 in East Africa, and 2 in Southern Africa, and then 1 in South Asia. And again, with the A site starting soon to collect data in India. I do want to stop here just to make sure that it's quite obvious that this is a CHAMPS network. All of this work that we're going to be talking about, and also the data that's available, comes from a wide array of partners and team members that this slide doesn't do justice. It's a busy slide, but there are many, many folks across the CHAMPS network at each of the sites that do contribute significantly to all of this data. So first, I want to get into a very high level aspect of the CHAMPS process with the special focus on the data collected and the data that's available. So in each of these countries at the sites where there's a surveillance area and a defined catchment area, there's a local team leads each of these CHAMPS processes. And due to the sensitivity in many cultures of reporting deaths in children under 5 and in stillbirths, the first step in the cycle is community assessment and engagement. And this strong social behavior work lays the foundation for the acceptance of the surveillance component of CHAMPS. And this surveillance component includes demographic surveillance, or DSS, so that a denominator is available for calculating site-specific cause mortality rates that can then be used in extrapolating CHAMPS data outside of the CHAMPS surveillance areas. In addition to the mortality surveillance that I will go on further about, we're also incorporating a more standardized pregnancy surveillance throughout the network. And this is to ensure not only that all stillbirths and neonatal deaths are captured, but also to provide more information on maternal risk factors for early neonatal deaths. So for all deaths that are notified and are eligible for CHAMPS, which includes a proper age of stillbirth or death within a child under 5 years old and resides in the catchment area, the family is approached for enrollment and consent to verbal autopsy and all clinical data that's available. And for those deaths where the death has occurred within 24 hours and the body is still available, the family is approached for this minimally invasive tissue sampling, or MITS procedure. And in this procedure, if the family consents, there is a standardized approach to collecting these tissue specimens as well as non-tissue specimens. And these non-tissue specimens include blood, CSF, NP swab, stool, and then the tissues include liver, lung, heart, brain, previously bone marrow, but that has been discontinued, and then placenta when available. In addition to these biological specimens, there are photographs taken to assess any gross abnormalities or birth defects, as well as help with the assessment of nutritional status of the child. And along with that, physical measurements or anthropometric measurements are taken as well to assess the clinical or to assess the nutritional status. And as I mentioned previously, with all CHAMPS enrolled, there is a verbal autopsy that is done on the child. And verbal autopsy, for those not familiar, is a series of questions asked to the decedent's family that pinpoints or gathers more information on the signs and symptoms and the occurrences that happen prior to death. And then additionally, if there are clinical records or medical records available on the child and the mother in those early neonatal deaths or stillbirths, that is obtained as well. So for those cases that deaths that have a MITS procedure and the specimens are collected, there's an extensive array of diagnostic testing. The blood and CSF undergo culture, microbiological culture. The blood also is tested in a standardized way for HIV, tuberculosis, and malaria testing. And then the blood and CSF, the lung tissue, the NP swab, and the stool also undergo an extensive array for other infectious pathogens using a multiplex PCR platform called TACMAN array cards. And then all of the tissues are evaluated locally for histopathology, as well as being available for more extensive immunohistochemistry or other more advanced histological examination at a reference lab at CDC. So there's a lot of data available on one of these cases, but coming from the postmortem diagnostics. So all of this postmortem diagnostic information, as well as the clinical data and verbal autopsy and any other data is available, is then presented to a cause of death determination or decode panel. Again, that occurs at each of these sites. This decode panel is made up of local experts, microbiologists, pathologists, clinicians, including the specialties OB/GYN obstetrician, neonatologist, as well as other public health specialists. And they look at all of these cases and all of the data with the ultimate goal of assigning cause of death, following the standard WHO medical certification of death. Additionally, they discuss the case for preventability. So was this death preventable? And then if so, what would be the recommendations to prevent this death in the future? So a little bit more detail about this cause of death or decode process, because this ultimately is the main part of the CHAMPS data set. So as I said, the panel comes together, discusses the case, and they define out the causes or conditions that existed in that child that led to death. Some cases there may only be one cause of death, and others there could be a series of conditions that ultimately led to the death. They record all of them, and they're recorded and then coded following the International Classification of Disease Guidelines, or ICD-10. So in the CHAMPS data set, if there is more than one cause, the causes fall within these categories. So the underlying cause of death is that disease or injury that initiated the whole chain of events that led to the death. The immediate cause of death is that condition which occurred chronologically closest to death, or which directly preceded or directly led to death. And then if there are other conditions that the panel felt were part of this causal chain, they're listed in the CHAMPS data set as morbid causes of death. Additionally, there may be conditions that exist in the child that the panel felt were contributing to the death, but not in the causal chain. And these are listed in the CHAMPS data set as other significant conditions. And again, these are not in the causal chain, because if that condition would have been treated or not there, that death still would have occurred. But it could potentially be risk factors for that condition, for the other conditions in the causal chain. Again, in the CHAMPS data set, which the cause of death data, the underlying cause is that condition that started the whole process. It's also looking, if you're familiar with other mortality statistics, the underlying cause was the one designated by the group back 60 some years ago that would, for the standardization of death data across, the underlying cause is the cause that's counted. But if there's more than one cause, then the other conditions in that causal chain are listed in the CHAMPS data set as either immediate cause or one of the morbid condition causes. Across, as I mentioned, this Decode panel looks at all of these cases across the CHAMPS network at each of the sites. We did spend a lot of time making sure that that process was standardized across all of the sites. So the main standardization we use is that adhering to the WHO classification guidelines, as I mentioned, as well as each of our panels undergo a standardized training. And we also develop diagnosis standards for the interpretation of complete CHAMPS data. These diagnosis standards are basically case definitions that were then adapted to help standardize the interpretation of CHAMPS specific data elements, specifically all of the postmortem diagnostic testing that occurs. It provides guidance to assign the individual diagnosis, but what it does not do is, was that condition responsible for that death? Because that's going to vary on a case-by-case basis, and that's where the panel takes the whole holistic approach to looking at all of the information from the case to come up with those causes of death. I note these diagnosis standards are definitely not an exhaustive list, and we are continuously adapting them as the CHAMPS data informs more of the definitions or needs revisions. I will show you when we get to the more interactive part where you can find these diagnosis standards, but I put up here as soon as the screen moves, and just an example of one of these diagnosis standards. There we go. That shows neonatal sepsis. what the panels look like to make sure that when they are calling neonatal sepsis in one site, we know that it can be the same as it's being called in another site. Again, I will show you where you'll be able to access these diagnosis standards if you want to read further. Okay, so back to closing the chain. So these cases are enrolled, the ones that undergo the MITS procedure and all of the testing have cause of death determined. And then ultimately, as I mentioned, the CHAMPS objective is to turning this data into action. And so it closes the loop by providing closure to not only just the family, but also to the community and a higher level so that this data can be used to prevent a future death. So to bring this overview home, I'll present an example. So in this example, it was a stillbirth, a female. The estimated gestational age by LMP was 35 weeks. The weight at delivery was 3.8 kilograms. The data available on the mother was that it was a 20-year-old, HIV positive, but on treatment. And this HIV diagnosis was prior to this pregnancy. It was a twin pregnancy, and the mother had undergone 4 antenatal care visits, which was the norm for this area. Of the stillbirth, the postmortem HIV, malaria, and TB testing was negative. Of note, the other twin was born alive with APGAR score shown there and a weight of 2,000 grams. So at the time of delivery, and if this would not have been a CHAMPS case, this stillbirth would have been attributed to obstructed labor. But since it was enrolled in CHAMPS and underwent all of the extensive postmortem diagnostic testing, one of the results that was found was that by PCR was positive for Treponema pallidum. So indeed, this was not an obstructive labor death stillbirth, it was due to syphilis. And just to show when it loads, the additional information that CHAMPS provides is this is immunohistochemistry. So it's staining of these tissues for this Treponema pallidum or the syphilis organism. Not to go into much detail, but the image of the liver on the left, all of the red staining is the spirochete, the syphilis bug. A normal liver of a newborn, you would not see all that red. And what is missing is more of the blue, which would indicate healthy cells. In the lung, if you look close enough, there are many red spirochetes there, as well as in the brain. And on this case, the placenta was available. And again, there was spirochetes or the syphilis bug seen in the placenta, as well as damage to the placenta due to this organism. All of this, again, is that this stillbirth was due to syphilis that was defined by the CHAMPS procedure. And the good news is that the mother, because of these results, in that loop back to the family, the mother and the twin were both tested and treated at the site. And at the time that there was additional follow-up, the family, the mother was actually pregnant again. And so the treatment ensured that this death would not occur, the syphilis stillbirth would not occur in this family. Okay, so I'll stop right there in case there were any questions that came up before going into more greater detail about the data.
Hi, Di. We don't have any specific questions at this time. Anyone who has more general questions can save them perhaps for the end and also check out our website for more information. But I think we are ready to move forward. Thank you.
Okay. Thank you, and that's a perfect segue. Jesse?
Actually, Di, this is perfect timing. As soon as I said that, we got a question from Carol, which is, how long does it take to get this data back to the family?
That's a great question. Thanks, Carol. So it does depend on each of the site. The metric that all of the sites strive to is within 3 to 4 months. Because of some of the advanced testing, especially in a case that there may be more complex testing involved, it may take a little bit longer. But the goal is to get it within 3 to 4 months. Some of them occur sooner if there's less testing involved. But great question, thank you. Okay, so with the website, which we're going to go through in here to give a high level of the data, I did want to point out very briefly, as I mentioned, that you can look for the diagnosis standards or any of the other protocols. If you go under the news and resources section, and champshealth.org is our website. And under the news and resources, if you filter by protocols, here are the diagnosis standards that I pointed out. But additionally, there is a document that does a more in-depth but overview of the CHAMPS process. And then if you want more further information, there are the protocols and more definitions available on this site. But the main focus of the rest of this webinar is looking at the data. So in the data section, there's many places to get to, but you can always go to the top of the page and then click on the data overview. There are 4 levels of data access that we currently have. In addition to those data levels on this page, there are more details about understanding some of the data. But also down below, I want to make sure that you look at that there are more further examples about case examples, in addition to more of the data to action, how the sites are using the data that they've acquired so far to prevent future deaths. But we'll start with this level 1 data. So the level 1 is more aggregate data on a summarized aspect, which is available in real time on this website. So if we click under the data summaries, the first page it takes up to is pretty much a snapshot of the data that's available. So it has across the network all of the deaths that were CHAMPS eligible, all of the deaths that were CHAMPS enrolled, and then those that were MITS eligible. Again, the MITS eligibility is that death that occurs within 24 hours and the body is still available. And then the number of MITS that have been complete to date, as well as those MITS that then had a cause of death assigned to it. So one way to use this website, if you're interested in seeing, just looking at those cases where a MITS procedure was completed and just wanting to look at how many were from Kenya. If you noticed, I clicked on each of those boxes, and then what it did was filter for those. You can also filter using the filters on the left for the sites, for the sex of the child, the age range, location of death, and that is either facility or community. I forgot to mention in the overview that the goal is to capture all deaths within that catchment area, both those that are occurring at the facility, but also, probably more important for some circumstances, those deaths that are occurring outside of a health facility or community. And you can filter for that and also for the time period. Just want to point out another aspect of this website. So we're filtering at all the MITS completed at the Kenya site. And down here, you can look for by the date of death, if there's any seasonality, or just the numbers that were enrolled with deaths occurring in that time frame. If to unfilter, you can either click on all of those boxes or just go back to the first part. So this is, again, real-time data, a snapshot of what is current as of today with the number of enrolled cases. But if we want to focus on the cause of death data, which I encourage everyone to do, those are broken out by the 3 different age groups: stillbirths, neonates, and infant children. So on this page, we're looking at just the infant children. And as of today, we're showing causes of death of 650 that fall within this age population. What this web page gives is the breakdown of those by the causes. And again, this top is looking at where, say, malnutrition or lower respiratory infection was the underlying cause or condition in the deaths. But we also show all of the other causes. As I mentioned, in most deaths, there could be more than one cause that the panel felt contributed to that death. And this is shown, all of those are shown here. A couple of the features of this part of the website is that if we just want to look at the cases where malnutrition was the underlying cause, if I clicked on that, it filters for it. So there's 109 of those cases where malnutrition was the underlying cause. With that being filtered, you can look down and see of those cases, sepsis was the predominant immediate cause, but there's also lower respiratory, and then lower respiratory is also seen as a contributor or as a comorbid condition. Another little feature I would like to point out here is if you hover over one of these, you can see case level information, de-identified case level information. But if you wanted to go further, deep dive further into the case level information, I will get in a few minutes to show you how you can download data sets. The other filter aspect I'd like to point out here, so when let's just get back to, if you could, as I mentioned before, just focus on one underlying cause. But if we wanted to see, say, lower respiratory infection, look at it if it appears anywhere in the causal chain and not necessarily just as the underlying. We can filter for that on the left and see that 282 cases have lower respiratory infections anywhere in the causal chain. Again, doing that by filtering from the CHAMPS mortality category. If we wanted to see of those 282 deaths, how many were community deaths, then we can just filter for that and hit apply. Same if filtering for the sex. For those hospital deaths, you can filter for if the hospital length of stay was known. And then again, as I mentioned, probably the most important part of the DECODE panel discussion when they come up with the cause of death is how is that death preventable? And so you can also filter for preventable deaths on this website as well.
Di,
yes.
We have a related question from an attendee asking about what data to action strategies there are for families who've participated in the CHAMPS program, since we want to help prevent future deaths.
So that is a very excellent question and can be a whole webinar on itself. I think just short and brief, I will say that it does depend on the sites and what they're seeing, but it goes back to that strong infrastructure that I talked about with the community engagement and the social behavior science, that is dependent on what that team is finding at the site and when they present the data back. I will say on an individual case basis, when the results go back to the family, they do spend, probably on most of the cases, they spend more time discussing if that death was preventable or future recommendations for that family, as opposed to the significant cause of death. That's a great question. I hope I at least answered part of it, but I think that could be a whole topic on its own. So I'll have to note that down, Jessie.
Thank you. We actually have a few more questions rolling in now. Is a good time now to take them?
Sure.
Sure, great. We have one question from Chidi, who asks, what are the uniformed challenges in enrolling families to determine cause of death in infants? And are there challenges unique to specific sites? Additionally, what are the lessons learned in using CHAMPS data to reduce cultural stigma associated with diseases such as sickle cell disease? So there are several parts to that question.
Okay. Again, this is great questions. And I think, Jessie, so I will get to those questions, that answer. This first part of the webinar is to focus on the data. But it's great that people are already processing the data and coming with those questions. I think we will have a special community engagement, social behavior science webinar, because those will address some of more in depth. But I will start off with the uniform challenges in enrolling families. Again, there are cultural, there are religious, but that's where at each of these CHAMP sites, when they started, they did do a strong formative research and focus groups to see what those barriers would be and how best to address them. There are certain circumstances that still cannot be addressed, say when there have to be short intervals between the death and burial. We see a significant decrease in the consent for obvious reasons, depending on the time of death. But again, that is uniformly, it probably is the timing of death to burial. Additionally, your questions are, and they are unique to specific sites. The lessons learned in using CHAMPS data to reduce cultural stigma, that goes back again to the strong engagement that the sites have with the communities, because that they're providing this information not only to provide closure of that death, but how the family can increase the health of the children existing in the future children. But I think that we definitely will have a special webinar series in the future that goes more into detail about those.
Thank you. And I have just one more question from Fatmata, who is from the SBS CHAMPS Sierra Leone site. They ask, I want to know if the data can show each disease by country as well as by case number.
Excellent question, Fatima, and thank you. And hopefully I answered those other questions with justice, since you are more knowledgeable about some of that. So, and back to this website I'm showing. So the website shows aggregate data on the network level, so across all the sites. So you can't distinguish the sites, and you cannot currently filter by the sites on this data. But when you download a public data set, which I will show you in the next few minutes how to do that, you can do individual line lists. They're de-identified, but they do have the site of origin associated with each cause and data available for individual case. But again, on the website, it is across the network.
Thank you. And one more just came in from Karen. Are there any of the qualitative data available for secondary analysis?
That is another great question. So currently, no, that is not part of the central database. So that would be something we would encourage folks reaching out to the individual sites. There are publications that have gone out using that data, but the data itself is not part of the central database.
Thank you. I think those are all of our questions for now, and we can press on.
Okay, thank you. So going back to this aggregate data, it's at the network level, but again, you can get to an individual diagnosis by here, but it does not show the site, what country of origin it was from. So I showed you that you can filter for just looking at those cases where lower respiratory or pneumonia was part of the causal chain. To unfilter, again, you can just unclick that box or go back to revert to all. But sticking with that lower respiratory infection, it's great to know that all of those cases where pneumonia did play a role, but you're probably asking, well, what were the pathogens involved in that? So that's where that tab, Infectious Causes by Etiology, you can drill down to that level. Say, for example, you're interested in respiratory syncytial virus or RSV. If you come over to the etiology name, you can filter for RSV, and what it will do, it will show you at the top, there's 21 cases of infant and child deaths where RSV was in the causal chain. 5 of those had it as that underlying or originating etiology. And then it breaks down where it showed up. Again, there was 5 that had it as the underlying cause, and then the remaining cases had it in as an immediate or comorbid cause. But if you're more interested in saying not just a specific pathogen, but any of the pathogens that were involved in those lower respiratory infection deaths, I'm now filtering for the CHAMPS mortality category and just selecting the lower respiratory infections and then hit apply. And now we're back to that 282 cases that had lower respiratory infections as part of the causal chain. But what you can see on this web page is that it then breaks it down into the etiologies associated with that, with those cases where lower respiratory infection, both when those cases where it was the initiating factor or it fell somewhere else along the chain. So I'll stop there if there's any specific questions about these two features of the website, both looking at the higher level of all the causes, but then being able to drill down to the pathogen level data. Okay.
Di, I think we have one question that I saw appear in the chat. I'm not checking the chat as closely as the Q&A box, but I do see that we have a question. Can we get microbiological and molecular biology reports on the database, particularly for those deaths associated with microbial pathogens?
That is an excellent question and a great segue. So what I was going to go to now is that this is level 1 data that was on the data set or on the web page. And we'll go back to where we started. So the level 1 summarized data. We do have a level 2 de-identified data. So this is de-identified data, but does include the line list, so individual data that does include the microbiology and the molecular results. So in these standard data sets, it includes case demographics, the verbal autopsy raw data, decode results, so those are the cause of death, the TAC results, which is that multiplex PCR testing, and then the lab results, which include the culture results from that individual case, as well as that standardized HIV, tuberculosis, and malaria. So the answer to your question is yes, that's available. It's available by this registering and requesting this de-identified data. The process to do this, I would first direct you to the CHAMPS Dataverse. So this is a website that houses, and it's going to load, it's a library of information for multiple data sets. I want to point out on this data, this is where you can find all of the documentation that you will receive when you actually request a standard data set. So if you have some questions about if this is what you really are looking for, the data set, or can we do it by just looking at the website, you can easily come here and download one of these specifications and then decide. But again, back to if it is something that you do want to download the data, it's just you register and request. It's a simple couple processes, some basic information. You will get an email after you register and agree to the data use agreement. You will get an email that will, within seconds or minutes, that will point you to a website to download the data set. Again, the data set includes files that includes all of this information. Additionally, with that data set, we're also having a GitHub portal, which posts, and there's a link to that as well, where we will be posting our codes that are used in publications coming out of the CHAMPS data. As well, what's currently there is a code in R, and for those not familiar with R package, it's a free data analysis and statistical software. And we will be posting any code through GitHub. There is one right now that is a general code that goes through some of the basic analysis of the data set as it's currently. But I just want to point out on this page that in addition to being able to download the code, there is an extensive documentation that's available with this. Again, this code is open access and can be downloaded with a couple of clicks as you're going through the website. And give me a second right here. Oh, sorry, jumped ahead a little bit. Just a couple more things about this. The R code that is currently up there is that some of the standard data requests that's been automated by this code is looking at the proportion of a condition and causal chain by age and site. And for example, I put here is that RSV in the causal chain. So the orange bars are the current proportion of cases that have RSV in the causal chain. This code automatically does that based on the data that was downloaded in the public data set. It does have some specific functions to look at the molecular data. So all of those cases where a particular pathogen is detected. Additionally, the proportion of infectious condition in the causal chain versus if that pathogen was detected. The top pathogens in the causal chain by age, site, or per syndrome, again, if just interested in pneumonia or lower respiratory infections. The postmortem interval, so that is the time between the death and when the specimens were collected. There is some hypothesis that can be looked at if a longer postmortem interval affects the results, but that can be done using the code that's available, as well as a few other automations. And then there's additionally in there code written for output. So you can put it as plots or tables or heat maps. And I do want to stress again that there is part of this code that you would download, the extensive documentation that's available that goes through more of details about the CHAMPS data with respect to running the code, but also more overview of how the code can be used. And then,
sorry, Di, do you have a moment for a question that has just come in?
yes.
We have two, actually. The first is from Abdullah. Is there any data for supervised classification purposes? Can we use this data set for our research and publication?
Excellent question. So we cannot stress enough that this data is open access. We encourage anyone, everyone, tell all your friends to download the data, use it as appropriate. Obviously, you know, we hope that it will be used to further reduce under 5 mortality, but used for teaching purposes is fully acceptable as well.
Thank you. We have one from Madiha. Are there any loopholes in data collection or sampling? Is it evaluated during and after data collection?
That is a great question too, assuming that no loopholes. So what I don't think we stress enough too is that all of our data collection is standardized across the sites. We do have some built-in data quality measurements as the data is being collected, but also as the data is being transmitted to the central database. In addition to those standardizations and quality control on the cause of death data. So we do try to limit as much of those loopholes as we can. But with that said, there are some things outside of our control. So the clinical abstraction data is we standardize the collection, but as you can imagine, with the variability in the different health facilities, if it's a tertiary facility versus a health post, the data that is collected cannot be standardized, or the data that's collected, the primary data collected cannot be standardized. So I would say that's probably the major loophole in the data collection is what the data is, the input of it. But there are multiple steps that assess and check for the data quality at each of the steps.
Thank you. I think that's all our questions for this moment. We'll move ahead.
Okay. Well, I just wanted to end with the data sets that are available for download on the website. Additionally, there are identified data sets that could also be available. And that also you can find information on the website. I will say that these take a few more processes, especially if you want completely de-identified. It requires ethical review and a more extensive data use agreement, but they are available. When it comes to the de-identified data, in addition to the standard data set, couple clicks, you can download off the website. There is additional data that's not currently in the standard data sets that could be available upon request. And if de-identified, this could be a very short turnaround process. And these would include pathology findings, so those specific diagnosis of the tissues, pathology slide images, all of the slides that are produced from the pathology, both locally and if it goes to the central reference lab, are scanned and available digitally. Additionally, there's clinical data abstraction, some variables that can be requested there. And the case photos is part of that identified, which would require more IRB ethical approval. We put there just to make sure that, to point out that not all of the data is publicly available because of these limitations of the identification, but they are available upon request. Additionally, not necessarily data related, but there is part of CHAMPS a biorepository that are aliquots of the tissues and the non-tissue specimens collected that are available. And in the near future, there will be additional information about how to request and what these specimens are on the website. So stay tuned for that. And that ends the formal presentation. Again, I just want to make sure that CHAMPS network is a network we acknowledge, most importantly, all of the families in the communities that allow CHAMPS to serve their areas, as well as the Gates Foundation that provides the funding, and all of our network members, and especially all of the team members at each of the sites, that without that, we would not be able to collect the data and hopefully reduce some deaths in the future. So I'll stop there and we can then open up for more questions.
Thank you, Di. We have several questions that have just appeared. Would you prefer that I read them to you, or are you able to see them at this point?
Why don't you read them so that everyone can hear them as well?
Sure, happy to. Thank you all for your questions. I see that a few people have raised hands, but I think probably the most efficient way to have your questions answered is to type them in the Q&A portion, and I will read them to Di. I have a question that says, over the Decode, there are cases which are labeled as undetermined. I would like to know your opinion on how such cases can easily be communicated to the family.
Thank you, Nish. And that, again, is I'm glad you asked this question for two purposes. One, it's good to point out that even with the most extensive information, the cause of death still may be undetermined on a case, and that is an acceptable cause of death. So yes, we do have a small proportion of cases across all of the age groups where even with the most conclusive data is undetermined. But because there's not a specific cause of death determined, that does not mean that that death could not be assessed if it's preventable. And this is true for any of the deaths that have distinct underlying causes, that the preventability and the recommendations that come from that aren't necessarily correlated with the cause. So an example could be a death that the panel felt was due to pneumonia that turned into a sepsis, and they said that's preventable. But their recommendation may not be related at all to that pneumonia and sepsis. If they felt that that death was preventable because the family was not able to seek health care before the child got severe, that was the recommendation. That could have occurred in any death, not necessarily being related to pneumonia. The same thing with undetermined. If there was enough information in that same example to say that, if the child would have been able to be looked at by a healthcare professional before it was too late, even without that specific cause, it could still be preventable.
Thank you. We have a question I believe you may have answered in part earlier. This question is there any room to use data for publication?
There is, and again, we encourage the use of data for all aspects, especially if it's going to help further the CHAMPS objectives. In the data use agreement that you would read, it does have a brief mention about publication. the only thing I want to say here is that as long as it's referenced properly, and that's where look at the documentation on Dataverse, and that if you would be willing to publish a code. But again, we encourage any use of the data and ideally in publication as well. With that said, though, I also do want to say that on the website here, feel free at any time when you're going through the data, if there's questions or any points of clarification, reach out to us. We want to make sure that our data is being used in the most useful way, but also that that if there are any questions or clarity that needs to be done, we are here for that. Great question, thank you.
Great. Our next question asks, what is the exact dimension or size of the pathology images from Martin Seppa, SBS, Sierra Leone?
Another great question. Unfortunately, the pathology size of those images are very large, about 1 to 2 gigabytes per file. That's why right now it is not, you can't just go to a website link and look at these images because of the largeness of this. And that's why they would be available upon request, and we would have to work with whatever works best for those that would want to see them to make sure that you can adequately assess them because of the large size. But again, I would say there are still shots taken from these slides that are part of those case examples on the website. And periodically check back on the website, you'll see more of these images that come from these slides, depending on the case example or the story being told.
Thank you. I'm going to turn my camera back on for this question portion, and Di, I'd invite you to do the same if you like. The last question I have posted here, there you are. The last question I have here is, can you please share the playbook for the verbal autopsy?
So the verbal autopsy tool that CHAMPS uses is the WHO verbal autopsy. We can put that, and that I do not believe that's currently on our website, but we can also put a link to that on our website with that documentation. But the code book, in one clarification, so because the verbal autopsy raw data is part of the standard data set, if you go back to that documentation that I pointed out on the Dataverse link on our site, that you will see in those specifications all of the questions of the verbal autopsy in that code book in that.
Great, thank you. I have another question here. There are a number of isolates identified and achieved in each CHAMPS site. Is there any sharing procedures for further genotyping and serological analysis?
Yes, stay tuned. We are just starting those processes now, both at the site level as well as for those sites that don't necessarily have that capacity to do right now at a more general level. But that also brings back when the repository, when that data or that information is available on the website, that could be something as well that if an external group, if there's certain isolates that we're not currently doing and some other group wants to do it, that's the way to go through that process.
Thank you. I've seen a few questions come through asking if we can share this presentation. This presentation is being recorded, and we will also make the presentation slides available to everyone. The plan is to have everything sent to registrants this week, and we'll also have things posted on our social media accounts, so you should be able to access them and forward them along to your professional networks. I have another question here. At which point do you think our data starts to influence national health policies? Great question.
Oh, if I had my crystal ball. Ideally, I would say now, a month ago, a year ago, but that is something that, we have to work with the sites to make sure that it's being addressed properly there. But at a local level, I can tell you immediately, as soon as the data is collected, as I'm sure you're fully aware, that the data is being put into action. But at a national or more global level, it does depend. I will say that, as I mentioned, the funding is provided by the Bill and Melinda Gates Foundation. It has influenced a couple of their priority vaccine strategies moving forward, the data coming out of CHAMPS. So. Great question. Thank you.
I have one question that appeared in the chat from Carol. It might be helpful if you could elaborate in the Q&A, Carol, but you mentioned you would like us to comment on vaccine preventable diseases. Is there a more specific question you have that you would like to enter into the Q&A? If not, Di, I'll let you perhaps comment on vaccine preventable diseases and CHAMPS.
So that's something, just very briefly, because I know we're getting close to time. With that, it would be at the actual pathogen level. So as I mentioned, it has some of the data has informed. So for some of our partners that are working on Streptococcus pneumoniae, we have specific data for that, and that's actually one of the examples in the downloadable R code in GitHub that you can look at that data. And the more general vaccine preventable bucket, that isn't something that's currently available in that standard R code, but that could be easily done by anybody that downloads the data set. A great question too, but that hopefully that would be a use that someone would use with the CHAMPS data.
Great. We've just gotten one more question. We have a few minutes left. This one says, over time, we have seen ICD-10 codes for diagnosis keep changing. What is your take on this for cases which have been diagnosed before the updates?
And that's a great question, because there's an ICD-11 that will be released for practical use within the next year or 2 years, which actually does do a significant change in the code itself. I will tell you, for CHAMPS, the data that is available is standardized with the ICD-10 code, but we don't lose that granularity that we get with the diagnosis, the text field diagnosis outside the ICD-10 code. So that is available. So we try to draw that line that we're doing as much for the standardization, but we're not losing any of that in-depth data, because I'm sure, as you're fully aware, there are many conditions where there is not an appropriate ICD-10 code. And so we do capture that as well in our data sets. And you will see we have some variables that are ICD-10 modifiers or supplemental codes. And that's how CHAMPS deals with those where it's not a direct, where the ICD-10 may be missing an important condition that CHAMPS is capturing.
Thank you. I don't see any more questions in the Q&A. I do see one in the chat I can ask. I noted that congenial disease is number 4 on your list. Can you elaborate on its importance?
I believe that this is the congenital birth defects. And so that does vary per site. We are actually in per age group. And it is very important. In one of our sites, we're actually seeing a significant increase in neural tube defects. And this is another great example of using the data to action. As soon as it was becoming obvious that there was a high proportion of these stillbirths and early neonatal deaths due to this, the site has been working with the local and ministry level officials to take immediate action to try to put in the prevention that could then reduce these deaths. Thank you for that question.
Thank you. I think there are no further questions at this time, so we can wrap up. You'll see on the slide Di has up, you can reach out with more questions as they come up at science@champshealth.org. Stay tuned for announcements about the next webinar. We will be planning those, and we will let you know over social media and through our email channels when that will be, and we hope you will join us once again. I have one more question here I may look at. I think I'll read this briefly, Di, and we can see. I know some people may have to go as it's after the hour.
Yeah. Jesse, let's address it offline just to make sure that it's for those that have to drop, that they're not going to miss anything.
Sure, we can address that later. We will get in touch with you about that. Thank you so much, everyone, once again. And Di, any final thoughts?
No, just thank you so much for all the participation. And again, any questions, hopefully you'll go and start looking at the data and downloading it and just reach back out to us if you have any issues or questions. Thank you again, everyone.
Thank you all. Take care. Thank you for joining us.